Previous episode that I discussed some minutes ago, I did state clearly the connection between Atomwise, which is an AI-based pharmaceutical company, and the development of COVID-19 vaccines before the pandemic in 2020. I clearly gave a timeline of how Atomwise engaged and partnered with various potential individuals and corporations in the development of the COVID-19 virus and the subsequent development of the COVID-19 vaccine. I stated clearly how Atomwise engaged with Pfizer, which participated prominently in the development of COVID-19 vaccines. Another potential individual party that played a critical role in the development of COVID-19 and the development of COVID-19 vaccines was the Bill and Melinda Gates Foundation. We all know that Bill Gates is one of the richest individuals in the world today, is one of the influential individuals in the world today. And Bill and Melinda Gates Foundation is a private company, private foundation with greater influence in the world. Now, being one of the richest individuals in the world and being one of the foundations which controls a large part of the global economy, the Bill and Melinda Gates Foundation participated critically in the COVID-19 fraud. Now, in this my document that I received from the United Kingdom, the 240-page document, when you look at page 66, from page 66, there are very many details about Bill and Melinda Gates and their involvement in COVID-19 fraud. But I will refer to page 66 of this article. When you go to page 66, somehow halfway, it is stated that from 1999 to October 2021, the Bill and Melinda Gates Foundation provided 14 grants to Gavi's global health programs, including PATH, totaling over $6.1 billion US, 4.3 billion having been granted in 2019 and earlier. Now, another timeline, November 2009, October 2009, the Bill and Melinda Gates Foundation granted $35 million US to the One Campaign, an international lobbying, advocacy, and campaigning organization to promote health, agriculture, and development. November 2009, the Results for Development Institute announced creation of a new Bill and Melinda Gates Foundation funded program to assess innovations in global health research and development policy and financing, including innovation inducement prizes and patent pools. November 2009, Rajiv Shah is nominated as USAID administrator. January 2010, during the annual meeting of the World Economic Forum at Davos, Bill and Melinda Gates announced that they will donate $10 billion US over the following decade to research new vaccines and bring them to the world's poorest countries. That is where our revelation starts. This is January 2010, and Bill and Melinda Gates are announcing that they will donate $10 billion US over the following decade. That is, they are predicting over the following decade. When we estimate a decade from January 2010, a decade will be January 2020. And remember, 2020 is when the COVID-19 pandemic emerged. And these people started planning in 2010, January. In January 2010, during the annual meeting of the World Economic Forum at Davos, Bill and Melinda Gates announced that they will donate $10 billion US over the following decade to research new vaccines. And bring them to the world's poorest countries. We are in 2010 January, and Bill and Melinda Gates are pledging 10 billion US dollars to research new vaccines and bring them to the world's poorest countries. And I believe that, according to them, the world's poorest countries are in Africa. Now, these people have given 10 billion for the research of new vaccines, and these vaccines are to be brought to Africa. This is in January 2010, and according to them, these vaccines will be available in 2020 when COVID-19 broke out. I can clearly state that for those who are following me, you can now start drawing the connection between Bill and Melinda Gates in 2010 and the emergence of COVID-19 in 2020. Let us proceed. March 2010, Donna B. Tillman, the former director of Office of Device Evaluation at the USA Food and Drug Administration, joined the Washington office of Microsoft Corp. Her main job was to develop medical information technology systems and expand the profile of its health group in Washington, obviously utilizing former position, insider knowledge, and contacts to facilitate greater control over healthcare systems, policies, and expenditures in the interest of our new benefactors through control of the US government patient records. March 2010, the Bill and Melinda Gates Foundation hired Richard Hendricks as its new chief financial officer. Earlier, he had been senior vice president, finance, and corporate controller of Merck, focusing on operations, governance, strategic planning, performance measurement, and cost management within the pharmaceutical and pharmacy benefit management industries. April 2010, the Bill and Melinda Gates Foundation nominates a Microsoft patent lawyer to the founding board of the Unitard Medicine's patent pool. We are in page 67 of our document. And April 2010, the WHO, that is the World Health Organization, reports that the Bill and Melinda Gates Foundation had provided 339 million US dollars in grants to the WHO during the period 2008 to 2009, making the Bill and Melinda Gates Foundation its largest private donor and the second largest donor after the US government. Now you can also see that Bill and Melinda Gates are now putting the World Health Organization into their pockets. We are in December 2010. President Obama meets with Warren Buffett and Bill Gates at the White House, subjects of discussion apparently being the economy and the billionaire's philanthropic endeavors, and the Giving Pledge project started by Buffett and Gates to encourage wealthy US individuals and families to give most of their fortunes to charity. Same December 2010, global health leaders launch decade of vaccines collaboration. Another critical point, we are in 2010 and global health leaders launch decade of vaccines collaboration. When we talk about decade in 2010, we are talking about 2020. And these leaders started planning the issue of vaccine collaboration in 2010, meaning there is something that they knew that we citizens we never knew. There is something that these leaders knew that they were keeping from us in 2010, and they knew that this thing that they knew was to happen after a decade. That was in 2020. I believe that you can surely predict that this thing that they knew and we never knew was COVID-19. Let us proceed. January 2011. February 2011. Buffett is awarded the highest civilian US honor, the Presidential Medal of Freedom, by President Obama. November 2016. Bill Gates is awarded the Presidential Medal of Freedom by President Obama. In August of 2017, the Bill and Melinda Gates Foundation donates $25 million US to the Barack Obama Foundation to support the planning, design, and preparation of the Obama Presidential Center. What a kind and lovely and generous gesture. Nothing to see here. In 2016, Bill Gates is awarded the Presidential Medal of Freedom. Then, in 2017, Bill Gates Foundation donates $25 million to the Barack Obama Foundation. It is as if that Presidential Medal of Freedom was bought. Then we proceed to May 2014. UK's biopharmaceutical company came up gets funding from the Gates Foundation and the Wellcome Trust, owned by GSK, $20 million from each donor for its Kymus platform to advance its therapeutic humanized monoclonal antibodies in areas of unmet medical need. August 2015, Bill Gates and Google Ventures participated in a $120 million fundraising for Editas Medicine. September 21st, 2015 to August 3rd, 2016. There are some details there. There are so many. Let us proceed to April 2016. Heptas and KMAB entered into an alliance to discover, develop, and commercialize antibody therapeutics targeting a number of G protein coupled receptors with an initial focus on immuno-oncology. November 2016, Chinese ORI Healthcare Fund and Shenzhen Hyperlink Pharmaceutical invested $100 million in the UK-based KMAB to advance its proprietary pipeline of first-in-class therapeutic human monoclonal antibodies and take its antibodies into the clinic. June 2018, the US Senate approves $2 billion raised for National Institute of Health. January 2017, during the World Economic Forum, the Coalition for Epidemic Preparedness Innovation (CEPI) was launched with commitments of $100 million each from the Wellcome Trust and the Gates Foundation, and an additional $260 million in pledges from Germany, Japan, and Norway to create new vaccines for very soon to be emerging infectious disease. Another critical point that in January 2017, during the World Economic Forum, the Coalition for Epidemic Preparedness Innovation (CEPI) was launched with commitments of $100 million each from the Wellcome Trust and the Bill and Melinda Gates Foundation, and an additional $260 million in pledges from Germany, Japan, and Norway to create new vaccine for very soon to be emerging infectious diseases. We are now in 2017, and Bill and Melinda Gates Foundation and the Wellcome Trust are pledging $100 million each, and governments of Germany, Japan, and Norway are pledging an additional $260 million to facilitate the development of new vaccines for emerging infectious diseases very soon to be. We are in 2017, and these governments are pledging a lot of money for the creation of new vaccines. Creation of new vaccines that we assume that they don't know. And as I said, a vaccine can only be created if the disease is known. A vaccine can only be created if the disease is known. And I believe that at the time these countries, Germany, Norway, and Japan, were pledging a total of $260 million, and Bill and Melinda Gates Foundation was pledging $100 million. Wellcome Trust was pledging $100 million. They knew that there was a disease. They had information about the existence of an infectious disease, and that is why they committed such large funds. And we are in 2017, And these governments, these corporations are pledging a lot of money, around 460 million US dollars, to create new vaccines. And when you talk about new vaccines, vaccines can only be created when a disease is present. And I believe you can still draw the connection between COVID-19 in 2020 and the events from 2010, and now we are in 2017. April 2018. During the malaria summit at 8 Northumberland Avenue in London, UK, Bill Gates urged Commonwealth leaders to commit to halves cases of malaria across the Commonwealth within the next 5 years, with a target of 650,000 lives. Subsequently, such subjects reached the public eye through news reports. April 2019. World's first malaria vaccine pilot program was launched in Malawi, one of 3 countries to pilot the programs, along with Ghana and Kenya. October 2021, WHO approved widespread use of the RTS malaria vaccine, and the rest. April 2018, in a discussion about epidemics hosted by the Massachusetts Medical Society and the New England Journal of Medicine, Bill Gates stated to his audience, "The next deadly disease that will cause a global pandemic is coming. We are not ready. It could kill 30 million people within 6 months. It might not even be a flu, but something we've never seen. Mr. Gates should invest in the magic crystal ball business." April 2018, let me repeat that. In a discussion about epidemics hosted by the Massachusetts Medical Society and the New England Journal of Medicine, Bill Gates stated to its audience that the next deadly disease that will cause a global pandemic is coming. We are not ready. It could kill 30 million people within 6 months. It might not even be a flu, but something we've never seen. I don't know whether Bill Gates was a prophet in 2018, because he predicted COVID-19 that happened in 2020. Let me just Google very fast the number of deaths, how many people died. Let me just Google that to find the number of people who died from COVID-19 in the first 6 months. How many people died due to COVID-19 in the first 6 months? I don't want to say that Bill Gates is a prophet, because to some extent he predicted what transpired in 2020 in 2019. He predicted what was to happen in 2020 as a result of COVID-19 in 2018. Now, in the United States alone, around 200,000 American lives were lost to COVID-19 in the first 6 months. And just a few seconds. Globally, as of 7:50 p.m. 4th October 2023, there were 771 million confirmed cases of COVID-19, and $13 million vaccine doses, with 6 million deaths. I want to say that at least Bill Gates did not accurately predict the number of deaths. But that aside, April 2018, Melinda Gates additionally states, the threat of a global pandemic, whether it emerges naturally or is engineered, is perhaps the biggest risk to humanity. And take note, in Melinda Gates' statement, she states is engineered. That means that a pandemic, there is a possibility of it being engineered. May 2018, Bill and Melinda Gates Foundation pledges 25 million US dollars and the government of the UK pledges 27 million US dollars committed to the funding over 3 years to the